Well, summertime is a time of joy for so many here in Michigan. It's a time to get out and connect with friends, a time to be more active, and a time to decompress. But summer is also a time for beginning substance abuse. According to a study from NYU School of Medicine, both teens and adults are more likely to try illegal and recreational drugs for the first time during the summer months. And even for those already in recovery, the fight to stay sober is much harder when the weather warms up. And after the past 16 months, substance abuse experts fear we're in for a torrent of abuse and heartache. Summer's here. Tigers games are packed, festivals are on, and more gatherings are coming back, like weddings and backyard barbecues. Summer brings good times, but it also opens the door to heightened dangers of substance abuse. Andrew Brown is a program manager in recovery services at CARE of Southeastern Michigan in Fraser, and he's been on both sides of the battle.
I've been in recovery since August 18th of 2007, so 13 years.
Brown says so many activities during the summer are tied to drinking, everything from hitting the water to hitting the links, and it can be difficult for someone struggling with substance abuse to be social and stay sober.
May I ask, was summertime a particularly difficult time for you?
It was, my primary substance at the end was opiates. When you can go swimming, when you can, do things outside of the house, it does. It was a hard time for myself.
That's in a traditional year. In 2021, Brown is worried about people trying to handle the reopening of society and managing sobriety.
This year, especially with COVID, I'm worried a little bit about a powder keg, maybe, that people are just so pent up.
People's anxiety was elevated, depression was elevated.
Nate Stone is a clinical psychologist with Birmingham Maple Clinic in Troy. He says during the pandemic, we saw a 13% increase in substance use and an 18% increase in overdoses during the pandemic. And alcohol and drug use during the pandemic could go into overdrive during the summer social season.
They were drinking a lot or smoking a lot during the pandemic, and now they're elevating it. And that has to do with a lot of people gained weight. They don't want to go back to work.
But summertime substance abuse isn't just about those already struggling with alcoholism and drug use. A study from researchers at NYU School of Medicine finds 34% of new LSD users started during the summer. 30% of marijuana and ecstasy users and 28% of cocaine users also began during the summer months. This is an issue for adults and college and teens.
We see a lot of that. People experiment over the summer because mom and dad are at work. They have more time, they can sleep in.
So what can we do? If you're in recovery, be aware of who you surround yourself with. When you're socializing, take someone who can help support you in your recovery and have a plan to get away if the pressure's just too much. If someone in your life is struggling with substance abuse disorder, approach them with love and compassion. Help them get help. And if you're wondering if you have a problem, well, it's probably time to reach out. You're not alone.
It's very hard in the long run to do this just by yourself. It really is. The relapse rate there is through the roof.
So reach out and get some help. Now, of course, there is a lot of shame attached to substance use disorder, and that keeps a lot of people from getting the help they need. But there are discreet and private ways to get that help, and so many different approaches now. The important thing is to not give up. And I want to thank both Dr. Stone and, of course, Andrew for sharing his story. Andrew has such a powerful story, and he shares it so willingly to help others. And I just want to thank him for stepping forward and for sharing it with us.
Because that resonates with people when they hear that, especially he's been sober for so long.
Absolutely.
But it's still a journey, and it takes others helping you out.
And one of the things that Andrew said is that during the summer, that CARE, they will actually take groups of people to Tigers games, and that's something that is particularly meaningful to Andrew. Yeah. So you can go there, you can have a good time at the Tigers games. Other people are drinking, but you'll have support, so you don't feel like you need to give in. You'll have support so you can stay strong.
Fantastic. Thanks again for sharing that, Andrew.